Hi, Kevin Sartin with Knob Physical Therapy with an educational video on avascular necrosis of the hip. So maybe you have some of the symptoms that I'm talking about, or maybe someone that you know, and maybe this video will benefit with them. I'm going to kind of go through the risk factors involved in getting avascular necrosis, the presentation, and then the treatment options. So avascular necrosis is a pretty rare disease. About 10 to 20 people per 100,000 will get this. So not super common. Most prevalent in individuals aged 30 to 50, and then more common in men than women. What might make you more likely to develop this is one, a trauma to the hip. That would be one. And then the other things would be if you've had long-term use of corticosteroids. So long-term use will make you much more likely to develop avascular necrosis. If you've abused alcohol at any point in your lifetime, that will make you more at risk. Or if you have autoimmune disorders such as like sickle cell anemia, that will also increase the likelihood that you would get this condition. So those would be the three things that you kind of keep in the back of your mind. If you have those and you have some of these symptoms, maybe this would be something I should look into. So the presentation at the beginning stages of avascular necrosis are pretty typical. Hip pain in the groin, down the thigh, into the buttock, like all other hip conditions are. There's 4 different stages of progression for avascular necrosis. The first one, you'll start to get pain with activity and it will feel better with rest, like everything else. So it really won't look any different than any other hip conditions at this point in time. Stage 2, you'll start to get pain not only with activity, but also when at rest, and you'll probably have start to have some range of motion loss at this point in time. Stage 3, you're getting significant pain at this point in time. You have pain with activity, with at rest. You're probably starting to have difficulty walking. You know, there's a limp that everyone can see, and whew, saved it. And at stage 3, we're starting to actually get on the head of the femur, some decaying of the bone. And I didn't even tell you what avascular necrosis was. Let me back up. Okay, so avascular necrosis is where you're not getting enough blood supply to the head of the femur here, and then it starts to decay with time. Whew, glad I covered that. But anyways, at stage 3, you're starting to notice some decay of the head of the femur that's going to show up on imaging. And then stage 4, the final one, this is not a good one. At this point, the head of the femur has started to collapse actually. So it's changed shape. At this point, walking is very difficult. You might even not be able to walk. And everyone at this point is going to know, like, there's a problem. Something's wrong with my hip. So as far as how to detect this, stage 1 and 2 are more tricky. Stage 3 and 4, they're going to show up typically on x-ray. We'll even catch these. Stage 1 and 2, MRIs can typically catch those as well, but it might not be something that they're suspecting at that point in time unless you have those 3 things in your background that I said earlier that might make them think of this in those early stages. Treatment options for this. The bone is decaying, so that's not good. So PT is really used as a way to manage symptoms or prolong that hip until they ultimately have some kind of surgical intervention done if, the decaying is continuing to happen. If it's caught early enough, they can do something called core decompression and place a bone graft in there. And what they do, it's kind of a neat surgery. So let's say that this part is decaying. What they'll do is they'll stick a needle in there, like suck out that dead tissue, and then put a bone graft in that spot where that space is at. And then since they've kind of created a cavity, so there's less pressure in that area, the blood supply is able to improve in that area since there's less pressure. And it helps to stimulate new growth with that bone graft that they put in there, and all is happy and dory. And this is typically just if it's caught earlier on. There's also something called an osteotomy. This one does not sound as good, but if there's maybe, just decaying part on this spot here, and they can change where you're bearing weight. So maybe you're bearing weight through that spot, and they can change the angle of your femur a little bit. They can take the pressure off of that spot of the femur and again help blood supply improve and heal that tissue. What they do for this, though, is they cut the femur down a little farther to change the angle, and then they put it back together. Doesn't sound great, but that's another option. And if those don't work, and we're progressing to that stage 3 or 4, then they're going to consider hip replacement. And you'll have hip replacement, which are good, have good success rate. And then after that, you'll probably have about 6 to 12 weeks of therapy at that point in time. So, like I said, it's a pretty rare condition. So don't go to I think I have that. So don't suspect that you have this necessarily, but it's a condition that's out there. And definitely, if you have those 3 risk factors that I mentioned earlier in the video, and a presentation similar to this, that would be when you would maybe talk to your doctor and be like, I wonder if this should be looked into. So I hope this video is helpful. Give us a call if you need help with anything or have questions, or visit us at our website at notpt.com.